And I wanted to talk a little bit about what the President said were his problems with the S-chip bill. And one of the things that he continues to throw out there is, well, this is socialized medicine. This is a big federal government program. It's a movement towards big government health care. And that just could not be further from the truth. Let's take a look at what the S program is. This is a block grant. The money is capped from the federal level. It's sent to the states, and the states carry out the program. It's a state-administered program, and almost every state in the country contracts out their S-chip program in the private health insurance market, in the private market. So this could not be further from a big federal government takeover, a socialized medicine scheme. It's administered in the private market. And we could spend our entire hour here tonight listing the groups that have endorsed this bill. But for the purposes of refuting what the President says, I would point to the health insurance industry in this country, which is certainly never going to support anything that's remotely close or a movement towards federalized health care, socialized medicine. They support this legislation, as does, as Speaker Pelosi often says, everyone alphabetically from the AARP to the YWCA. This has overwhelming support around the country, overwhelming support among Republicans, and overwhelming support among Democrats. So, again, the President's welcome to veto this bill. He's able to do so, and he exercised that right. But let's be truthful about what's really in this piece of legislation. He talks about how it affects families making up to $83,000. Well, what are the facts behind that claim? Where did that number come from? That comes from the fact, as I said, this is administered by the states. And I would welcome my friend from Ohio, Mr. Ryan, as well, who is taking a break from watching the Cleveland Indians tonight, I'm assuming. Welcome. We have $83,000 as 400% of poverty. There was one state in the country, New York State, applied for a waiver. 400% of poverty they wanted to cover. That waiver was denied. It did not take effect. No other state in the country does it.
Mr. Altmire,
I yield to the gentleman from Florida.
What I would like you